Hasn't there been a push by you to, I know that most of the schools are back fully in person, to mandate that as Massachusetts has done?
Yeah, so I mean, we made the effort to make sure that teachers were vaccinated before Massachusetts, by the way, and make sure that the supportive staff, along with our child care, were vaccinated and the supportive staff. I think you're going to see, I've mentioned that we're going to be fully opened in September, and I think that you're going to see that there'll be positions that we'll take at that point in time. Right now, the preference is that people would be in school. So I visited a high school yesterday with the commissioner and the superintendent, and we want to make sure that the students and the families know that they're safe. So we're encouraging it right now, during the balance of the school year. That's the reason that we vaccinated the teachers, and we certainly will be supporting the commissioner in a all-in strategy in September that we'll be talking about next week sometime.
You had mentioned a couple of weeks ago that you presumed that wearing masks would still be part of going to school in the fall. Do you still believe that to be the case? And as outdoor mask wearing rules are being eased, do you foresee any of that indoors anytime soon?
So in the schools, I've asked, I was asked this question again publicly yesterday. I only can tell you what I know at the moment. Before Tuesday, when CDC came out with their new guidance on the mask, we were holding true in terms of what, the policy that we had. We changed it quickly. So if there's changes in the science and in the medical area that makes sense, that's fine. But right now, my understanding is that there would be masks in the schools in September, but that all can change based on advice that we get from the health department and from both nationally and locally.
Governor, any thought of paid sick time for people who have had the Pfizer, Moderna, or any shot, Johnson & Johnson, are sick and unable to work for a day or two after they get the vaccine? Some people are writing in and saying that for up to a week, they're having to take naps. Is there any thought of doing something like that?
Well, I guess you would take it on a person-by-person basis. If we knew that what was, what you're referring to, Bill, then we certainly would follow up on it. I think if it becomes a problematic area in a large way, we would address it officially. But I would think at this point in time, they would work it out with their employer.
Governor, were you surprised the resignation you received this morning from Courtney Hawkins?
Yes, I mean, surprised in the way that the first time I heard it, right, in terms of resignation. I believe it's effective as of May 14th, but and we'll work with the director along with to make sure that we replace and have the department running during the transition. So yes, so I mean, a surprise to the point where you're always surprised to see the thing for the first time, but I know that Director Hawkins, in terms of even my transition, was very, very highly thought of in all the recommendations I received. That's the reason that I, offered to have her continue to be director, and she accepted. So we'll follow up with her personally, during the next week or so to make sure there's a smooth transition there.
I just want to follow up. It was reported you made an unexpected visit to Zambrano Hospital yesterday. Can you touch on again the problems with that and Eleanor Slater? And granted, you inherited both, but what can you say about the unexpected visit there?
Well, again, we're trying to come up to a recommendation, John, in terms of what we're going to do. I don't think that we put a hold on that. That's not the only work that's being done. We've got people in our office, Joe Almond included, who is really focused directly on that on a daily basis. So this was part of the, the effort, right, to get an updated. We met with a doctor up there last night, walked through with our acting chief of staff. It's all in the due diligence. It's all into trying to figure out. There's no easy answer there, as you can imagine. And we want to make sure that we're touching all the bases, and a visit there made sense to do it at this time. We really want to get something. We really want to make a recommendation before the General Assembly leaves in this session. We put in a very high dollar number to be, potentially to be in a building, whatever it might be, but we still need to fit, make sure the plan's there, and the goal is to have something there before the end of this session with the General Assembly.
Is that just a message to all departments across the state? They should operate with the expectation that at any moment, Governor McKee could come walking through the door?
Yeah, I mean, that's the way, it's a management by walking around, and we've communicated that to all the department heads. I've already been in several departments. I intend to be in all the departments during my first 100 days. I think I'm on day 57 right now.
Specific questions if we can. Pat, Amy, Anita.
Right. Governor McKee, despite federal tax exemptions, the state wishes to tax PPP loans. The state wishes to tax full unemployment. With billions of dollars of federal aid on the way, and a state government that has not issued furloughs nor inflicted any real salary cuts, why is the state hell-bent on taxing the individuals and businesses most impacted by COVID?
Yeah, so let's talk about the PPP, all right? We exempted 90% of the businesses that borrowed on the PPP. So if anybody's out there saying that we're not addressing the small businesses, they're misinformed. So 90% have been exempted because 90% have borrowed $150,000 or less. So let's make sure that that's very clear to people. There's no attack on the small businesses. In fact, I'll repeat, that we protected 90% of them. The businesses in the balance have earned a great deal of money. And so the question is, who pays their fair share? So my position has been that we exempted the majority, overwhelming majority of the small businesses that struggled. But many of these businesses who borrowed $4, $5, $6, $7, $8, $9 million, they're making hundreds of thousands of dollars, if not reporting millions of dollars of income. So I think it's fair that people pay their fair share. And I feel comfortable, as I said before, that I'll stand, by the budget. By the way, a budget that had to be done by March 11th, and there was over a $300 million structural deficit when I actually got into the discussion, and we handed a balanced budget to the General Assembly, and it would have been, we'd have had to go at $70 million of cuts, or $70 million of programs that didn't get funded. I believe that we're in a good spot. The General Assembly will make up the decision, and if they can find a better way to do it, then then I'm not going to veto a budget because somehow that got filled. But I think you're going to find that the general public is going to be supportive of an issue where people who need the help, the tax relief, get it, and the people who don't need the help at this point in time, a small amount of businesses, they pay their fair share.
So, if I could follow up, please. The decision to tax full unemployment, are you arguing that Rhode Islanders are in a position to be taxed on unemployment when virtually the rest of the nation is following the federal exemption? And again, no shared sacrifice on state government.
We can talk about it offline, Pat. We'll email. Amy?
Ever since April 19th, it seems that every time you check the vaccination portal, there are thousands of appointments still available, even today. And do you think that maybe not enough young people are getting vaccinated? Are you worried about that? Or is supply just more than we need?
Well, again, I want to make it, again, clear that last week we vaccinated more people than any 6-day period since we opened up the vaccination sites. So that means there's still a great deal of people willing to get vaccinated, right? And now our work is, as Tom and the doctor mentioned, is really get out in the communities. I think you're going to find that the young people are going to respond, as any age group does in the state of Rhode Island, that they're going to get vaccinated because they want to get their lives back as well. They want to go to the proms, right, in the high school. They want to be at graduations. They want their families to be at their graduations. The vaccines is a route to do that. So I'm not concerned yet about that because we're talking to universities in that age group as well. I believe that there's over 60,000 students in the state of Rhode Island that live in Rhode Island that attend our local universities that are going to be vaccinated before September. So the verdict is out on that. We're certainly cautious, but very optimistic that we're going to hit the numbers that we need to in every age group in the state of Rhode Island.
Governor, are there plans to have high school vaccination clinics in hard-hit cities, Pawtucket, Central Falls, Providence?
We're offering to any school district in the state, any LEA in the state, to have on-site. Like I mentioned, I think we're going to be in North Kingstown next week. We're going to be in Johnston, my hometown of Cumberland, as well as Cranston. So any high school that is interested in having it on-site, we will make sure that happens.
Have they reached out to you, any of these hard-hit zip codes?
I don't have the list yet, but I know we've made the offer and we're making the contacts through the municipalities. I would expect that that's going to really ratchet up, and I would expect to be in high schools around the state, including communities that you just talked about.
Lastly, in regards to, I know we're talking about graduations. I know this is particular, but will you be handing diplomas? I know some of the guidance I think RIDE sent out to schools aren't updated with the current guidance. So what is that going to look like? And will schools be updated with this new guidance?
I don't know the answer to that. I watch Wheel of Fortune every once in a while. They put a little cylinder there and they turn it around. So there's got to be a way that we're going to be able to hand those. The main message there, and I'll let the commissioner weigh in, but the main message is we want everybody to get vaccinated, including the high school students, so that they can have a graduation that they didn't have last year. And the opportunity is there, and we're going to try to do everything we can. It's an important day in the families and the students, and we want to make sure we honor that.
The EDUC is working with the superintendents, and there will be clarity around what the logistics of all that will be.
Would you rule out carrier pigeon? No. Johnson & Johnson vaccine now back in the rotation. Are you seeing people wanting that one versus the other? A Moderna shot is a 6-week process. Pfizer is 5. Johnson & Johnson, one and done, and within 2 weeks, you hit, as you explained, the 2 weeks after. Are you seeing people want that? Because it seems like there's been a drop-off of people clamoring for the vaccines at the pause. And are we going to get more of the J&J?
Yeah, so all great questions. So I will say that we've just lifted the pause, so it's a little bit early to tell. I do encourage people, certainly if they have questions, to talk to their healthcare provider. You know, again, reminding people that may have be a little bit predisposed to clotting. There's a lot of different health conditions that may predispose one to clots, thromboses. That there's 2 other vaccines out there, right? The Moderna and the Pfizer, and those have 0 safety signals in them. So there's different options. The benefit, of course, of the Johnson & Johnson is that it's 1 dose, 1 shot, and then you're done. Also keeping in mind that even the risk of clot is really incredibly rare, and I can't underestimate that. So really incredibly rare. But again, if people feel uncomfortable, talk to your provider. Also consider, of course, the Moderna and the Pfizer vaccine.
With the open appointments, Dr. Chin, I know the governor had said before he'll be concerned when the vaccines don't get used. So there have been thousands of open appointments. What happens? Is there a vaccine that's not being used, or does it just get pushed another week?
It just gets reallocated, and that's a big part of our shift to, away from those Tuesday, Friday releases. So every single day we're monitoring the uptake, what the availability looks like. So it gives us a higher degree of flexibility, which is why we're able to go to businesses, go to schools, go to community events. So none of this is going to waste. Our waste is still less than 1/10%, which is unheard of in vaccines. And we're just reallocating it, in real time, very dynamically.
Anita? Tom, how are no-show appointments going? I know you saw an uptick. What was the status on that?
It's remained consistent at about that 10%. Now that we have the walk-up vaccinations, though, that's kind of made up for what we've seen with regards to no-shows.
Governor, are you
Hi, Tom. Is there ever a point where the federal government will stop shipping vaccines sometime after July 4th when we're not going to have all these large shipments come in?
Yeah, we don't have a date for that yet. Eventually, right? But I think a couple of things on the horizon. One is, approvals for probably the next group, as Dr. Chan mentioned, 12 to 15, which we're hopeful, is sometime this summer before school starts. And then, even younger Rhode Islanders, which for planning purposes, we're thinking sometime in the fall. So I think throughout most of the summer, we'll continue to see shipments. What those look like, we're not sure. But I do know, the Pfizer and Moderna production is at peak capacity. We're getting enough doses. Supply is meeting demand, which gives us this flexibility. So we're in a really strong position.
Governor, are you concerned? There's a story in this morning's Boston Globe that our unemployment's over the national average, but retailers, restaurants, manufacturers still are having a very difficult time trying to get workers in, employment agencies. There are several types of businesses that are actually starting to close because they can't get the staff to work at a restaurant on a Monday night or to be there on a Sunday night.
Very concerned, and we followed up with a piece of legislation that I think is going to help in that area. We're also going to make sure that as we implement that that people are going to be, need to qualify that they're seeking work to be able to collect unemployment. That's coming. And also, when we move to protecting people that are coming off unemployment on that $300, John, I'm expecting as a small business owner that small businesses will provide the same work schedule to people who have been working and have been paying, really very loyal to these businesses, that they're going to probably do the same thing. So I'm not as concerned about the unemployment rate at this point in time as I am in terms of the work rate. We want to make sure our businesses have the number of hours that they need to run their businesses, because we're going to have a really good summer, and we're going to want to make sure that we take full advantage of the economic upturn that is coming that we fully expect.
Dr. Chan, there's still some people out there.
Oh, sorry, Stefan, do you want to?
Just to add to the governor's points on the UI bill, we're very pleased that with cooperation both from House and Senate leadership, there is a bill that is moving, authored by our Department of Labor and Training with the House and Senate, and we're very pleased to see that happening. It enables individuals on UI to earn up to 150% of their benefit amount before they are removed from UI. Currently, it's 100%. And they can also earn up to 50% of their benefit before the earnings are reduced. We can explain more if folks are more interested, but that's what the governor is referring to, and is absolutely correct in saying that that has momentum. Thanks to leadership in the Senate and House, they've taken their own initiative to try to move this forward, and we hope that in the next couple of weeks there can be actual passage in some form and movement to final enactment of those bills. So that will help. The other thing I just wanted to say, for those individuals out there who are in fact seeking work and are hearing this and thinking, goodness gracious, I would like to find a position and get employed if restaurants have availability, if other establishments have availability. We have a website, backtoworkri.com, that the Department of Labor and Training in partnership with others maintains, and we can actually help assign a job coach. We can connect you with businesses that are searching for work. We can connect you with postings, because there are in fact so many openings out there.
What about lifting restrictions for bars, restaurants, nightclubs?
Those are on the way. So there are several moves that are occurring related to bars and cocktail hours in catered event contexts, May 7th and May 28th. So May 7th, outdoor bars will be able to reopen inclusive of standing service. And May 28th, that occurs indoors and outdoors. So we're encouraged that that will be occurring. By the way, bars are open in the sense that they can operate right now for seated service only. And for the majority of the pandemic, we've gone to great pains to create a safe condition under which bars can operate.
You envision restrictions on bars being lifted as more time goes on?
Yes, May 28th, for all intents and purposes, bars restrictions will be lifted. The caveats on all of these points are, one, mask wearing indoors whenever not consuming, that is to say, eating or drinking, and the 3-foot rule between people whenever possible. But yes, those restrictions will be lifted.
Bill, Pat, Alexa, and we'll end there.
Dr. Chan, good afternoon. There's still some people who are out there shockingly saying that masks don't work. There's no evidence to connect that they've had anything to do with the pandemic. There's at least one person who claims to be a medical doctor constantly saying this on different channels here in Rhode Island. Now that we're shifting to an indoor mask-specific requirement, what do you say to these people?
Yeah, I will say that there is evidence for sure that that masking works. It's something that we've done in the healthcare field for decades and decades, commonly accepted. And so this goes back to one of my points about indoors versus outdoors. Outdoors is so much safer, just with that open air, more room to physically distance. It's really that indoor setting that we need to be more careful about. And we know that masks especially protect others around you. Again, we know that up to 50% of COVID is asymptomatic. So if you unknowingly have it, the mask will prevent you from transmitting to others. So it's not just all about you personally, it's about the people around you and protecting them. And of course, we know that masks will also protect you, the wearer, from others around around. So there's a lot of evidence that has accumulated. We do need more evidence. I want to point that out as well. There is still some limited evidence. And during this pandemic, as we've seen in many things, we're still learning every day. So more to come. But to date, the preponderance of evidence does show that masks are effective.
Governor McKee, two things. Number one, under the proposed MACT legislation, is that going to effectively limit the amount of hours that someone can work depending on their level of compensation? In a sense, creating a situation where you're going to have a balkanized work week, leading to all sorts of training issues and scheduling issues. And also, I wonder if you could follow up on the notion that Rhode Islanders' personal unemployment insurance should be taxed in its totality.
So first, we've worked with the restaurants and other people who need employees, and they are supporting the legislation I believe you're referring to. So they'll manage it. And then, second of all, remember on the unemployment issue, when I had the deadline of March 11th to put the budget in, the federal guidelines were we didn't even know that there was federal dollars coming in. And right now, we're still looking at what you can use those federal dollars for. It is not clear that you can use those to cover any lost revenue that you would be anticipating. That could become clearer. So it becomes an issue with what you're talking about in terms of the PPP for the 10% of people who made some money wanting to get relief. And in addition to that, on the unemployment, it's about $100 million that the General Assembly would have to figure out how they're going to balance the budget. In fact, they do either one of those. And so we'll see what happens there.
Follow though. And no one's doubting the work ethic of state government, but at the same time, throughout this entire process, there has been virtually no shared financial sacrifice by folks in state government. I would question, if we've done this before, whether anyone at this table has had to take a salary cut. At the same time, you're looking to tax, again, on a federal level, tax-free unemployment compensation to the Rhode Islanders who have suffered the most.
I've answered that question. At the time we put the budget in, and we'll get through this, that was not an option that you could consider at $100 million. We had to balance a budget. Look, Washington prints money, Rhode Island doesn't, and budgets are difficult, and that's what they're all about. But these questions are what I believe we're going to have another open Tuesday press conference, and we want to focus on those issues at that point in time.
Governor, you said that businesses and nonprofits, if they want vaccine clinics to just basically come to them, just to contact your office. Is there any minimum requirement for staffing, what type of industry they're in, or what their facility even looks like in order to bring shots right to them?
Right now, it's, if we can, the community center that we visited today, National Guard was there helping facilitate that vaccination. I believe about 40 people are going to get vaccinated. So, and then yesterday at Electric Boca it was 650. So, it's a wide range, but we'll go anywhere where it makes sense. And then if somebody's got a handful of people, it may be just a personal visit to them. I know that this center was actually doing a personal visit today through the National Guard of somebody who was still, didn't have the access to a vaccine and wanted it. So I think that we're going to be very, very flexible. If it makes sense, we're going to do it. And if we need to give guidance to individuals that are, contacting our office, like Fidelity today, they're going to Smithfield High School. So we're going to be able to figure out a way. We just want people to call and that they identify that they have an interest and they haven't been vaccinated. We're going to get them vaccinated.
So it's not like it's a restaurant or retail store that would contact you and said, I want shots to come.
No, we would go to a business as well. We would go to business, a community center, a school. We'll go where they are. We have piloted a little bit in the restaurants in both Newport and the Providence area, so we're prepared to go virtually. We'll go to an office building. We're talking to a couple office building owners right now that feel as though they could get several hundred at one time. We're talking to a business that's, is a bank, a large bank that has the corporate headquarters in Johnston that we're talking about potentially going there. So, we're open to the calls and we'll make it happen.